know, this world and the United States are going through uncharted waters, and we are having to do things much differently in the EMS, fire and EMS world. Today, we are taking on additional measures from which we can treat our patients and making sure that they get the best treatment necessary, but also direct them to the treatment areas or centers that they need to have. For those patients that meet a certain criteria, and then we get them cleared through the medical director, we will treat on scene and not transport, and then we'll leave them with a data sheet of how they can follow their illness or follow their signs and symptoms. And if they need to call us back, we certainly can. Just because we make a call out, we treat in place and don't transport doesn't mean they can't call us back.
Well, what you can expect when you call 911 for flu-like symptoms when a provider shows up at your home. They will initially approach you and they will be wearing a surgical mask over their face, they will be wearing gloves, and they should immediately hand you a mask to place over your face. This is done just as a sheer abundance of caution, since the CDC considers this virus to be spread by droplets. They will then conduct an oral interview and ask you questions as far as could be related to, have you been around anybody that's been sick? What are your current symptoms? How severe are your current symptoms? They will then do a physical assessment of you to include your vital signs and your temperature. And then upon the completion of both of those segments of the assessment, a determination will be made if you fit the criteria for transport or should you stay at home for treatment.
This does not impact our chest pains or difficulty breathing or congestive failures or falls. It's really people who are exhibiting minor signs and symptoms of what would be defined as either the coronavirus or a flu-like symptom. And if they don't have those significant symptoms, or they don't meet a certain criteria with other complicated health issues, age, vital signs are abnormal, stuff like that, then we're going to try to treat them in place so that we don't expose other people to either the flu or the virus. And if we can do that, then we can stop and we can flatten that curve, and that's what we're trying to do. So just be patient with us, be patient with local government as we navigate these waters, which we've never been before, and we try to understand what is the right thing to do for our community, for our state, and for our nation.